Hearty welcome. And actually, it's a hearty welcome because we have a hearty doctor with us all the way from New York City, Dr. Sandeep Jauhar, who's been working as a cardiologist over there in the Long Island Jewish Hospital for 13 long years. He's also an author of 4 books, a TED talker, and also featuring on Netflix, the series called Explained. We are very happy and glad to have you, sir, on board. And today's topic is going to be about heart disease reversal. So, first of all, we would love to welcome you on board, and you're saying hi to the audience right now.
Hi, good to be with you.
Thank you so much. So, I want to come straight into the approach of heart disease reversal without getting too much into the exact causes. We can touch upon the causes on the way and all that. But as we were discussing earlier on, I think Dr. Dean Ornish did a phenomenal impact earlier on in the last century with heart disease reversal, and he introduced vegetarian diet, Surya Namaskara, meditation to the world. And lately we've had Dr. Caldwell Esselstyn, who's again on a very, very strict zero oil diet from Cleveland Clinic, 67,000 people working. The clinic is at top clinic in last 25 years. In India also, we've got Dr. Chaje, who does a lot of work on zero oil diet, on coronary artery reversal. We've been, of course, working in diabetes and metabolic syndrome reversal, and many of them, as we know, almost 60% plus would have heart disease at some point of time. We have our own set of experiences on that. But it would be interesting to hear from you with such rich experience you have in terms of how does one approach in context of people who already done this work over a period of time, and whatever your experience is for coronary artery reversal. Yeah, please go ahead, sir.
Yeah. So, I mean, look, as a cardiologist, I know and I see every day how much coronary disease affects South Asian population. It's a massive problem. And, so we all want to see how to reverse coronary disease. That's really sort of the holy grail. I've seen Indian men who are only 20 years old come into the hospital with heart attacks, Indians suffer more from heart disease than really any ethnic population. South Asians in general do. And they develop coronary disease in more and different arteries, and also at a younger age. So it's a massive problem, and we don't know exactly what the issues are. There are studies ongoing trying to identify the risk factors. The risk factors that we know, like diabetes and hypertension and smoking and so on, were really discovered by studying mostly white European populations. Now, they probably apply to Indians and South Asians also, but I've seen heart attacks in Indians who have 0 or 1 traditional risk factor. So there are probably other factors that play a role, and I think a lot of work is being done and will come out in the next probably decade or so that will kind of elucidate what's going on and why Indians have such malignant heart disease. But as far as heart disease reversal, coronary reversal, I think Dean Ornish was onto something when he published his initial studies. So he had a sort of plan that combined stress reduction, exercise, and a diet that was very strictly vegetarian with very low fat. And he found that that kind of diet resulted in coronary artery reversal. Now, when I researched Dean Ornish's work and actually interviewed people in the Ornish organization for my 3rd book, which was called Heart, A History. It's also available in India. What I found out was that some of the people who were randomized in his most important paper, actually followed diets that were nearly as rigorous as those in the intervention group. So, but their coronary disease still progressed. What Ornish found was that stress reduction was probably the most important factor in coronary reversal and was just as important, if not more important, than exercise. So, a big part of my book, Heart of History, is talking about the effect of emotional stress on heart disease. And I think Ornish's research that shows that stress reduction is so critically important for coronary reversal really points to that. There's so many aspects of stress: acute stress, chronic stress, occupational stress, family stress, that affect our hearts and our coronary arteries. So I really dive into this very deeply in my book, Heart.
Interesting. And what do you recommend for stress reduction in general, as some direction or tips which are there in the book, which of course people would love to read in detail and right now for the audience?
Yeah. I mean, it all depends on who you are as a person. I mean, there's no one size fits all. Some people find meditation to be very helpful. Some people do yoga. I have friends who do hot yoga, which I've tried, and I actually find that even more stressful than doing nothing at all. I personally find that a daily jog for 15 or 20 minutes is incredibly helpful in alleviating my stress. So, it all depends on the person. I think the most important thing to remember is that stress is an important risk factor for heart disease. And even some of the top cardiology associations do not list emotional stress as a key risk factor. And that's despite the fact that we have so much research showing that people who are stressed get premature atherosclerosis. So I think the most important thing is to identify or to recognize that stress is important, and then look to yourself and see, what is it that alleviates my stress? For some people, it's prayer. For some people, it's spending time with friends. For some people, it's meditation, yoga. Others, it's aerobic exercise. But whatever it is, it should be individualized to who you are as a person.
Interesting. Very interesting. Okay, just one medical thought over here, which I had come across. I don't remember the exact reference. And it shared that fasting insulin scores, were even more important than smoking as a determining factor for heart blockages. And I was just wondering, while you were sharing, in case if there were any further insights as a cardiologist, and whether this particular investigation itself is being utilized regularly with patients. As you said, 20 years young Indian or South Asians have come, and has there been any effort on tracking this particular parameter? And also, from your experience, is there a validity for it?
I think there's a validity. There's not enough work that's being done. So we focus on the traditional risk factors because they were studied in a small town in Massachusetts called Framingham, that on mostly a Western European or Americans of European descent. And what we learned is that, yes, diabetes plays a role, smoking plays a role, hypertension plays a role, family history plays a role, obesity plays a role. But like I said, in Indians, South Asians, you see heart disease without any of these traditional risk factors. You see heart disease in people who have so-called metabolic syndrome, who have insulin resistance. So I think that in our kind of people, in our ethnic group, insulin resistance and spikes in insulin play a major role in accelerating, atherosclerosis and the development of fatty plaques. So, yeah, I mean, I think anything that we can do to combat metabolic syndrome, which is insulin resistance, which is high levels of cholesterol, which is elevations in lipoprotein little a. These are all factors that probably play a more important role, or, well, as important of a role in the South Asian population as these traditional risk factors that we know from mostly white populations.
Absolutely. I think we need to treat this population a little differently than the white population. I think there's enough talk about that. Talking about lipoprotein A and total cholesterol, I think the HDL versus total cholesterol ratio, which is, told that one is to keep it 1:4 or even better. So if you could just talk on the genetic components over here and modifiable components over here, and the role of statins or any other drugs in terms of, it may not cause immediate reversal as such, but something in terms of heart disease management is crucial. So, yeah, your inputs on this.
Yeah, I know. I mean, lipoprotein little a is a novel risk factor. It's well described as a cause of accelerated coronary disease. The problem with lipoprotein little a is that we don't really have very effective drugs to reduce it, like we do for total cholesterol or LDL. So it's important to know that it's a risk factor, and there's quite a bit of work being done now to identify, develop drugs that do reduce lipoprotein little a. But right now they're still in development. I mean, as far as statins go, I'm a firm believer in statins. I do think that statins play a major role in fighting heart disease. I think that oxidized LDL is a big factor in the development of fatty plaques and the progression of heart disease, coronary disease. So, I mean, I encourage my patients to take a statin. I personally take a statin. I have elevated cholesterol. I had a CT scan that showed that I have the development of some coronary plaque. And so, I was very worried about it, given my ethnic group and given, the fact that Indians very often will develop heart disease at a very young age. So I started a statin. I think that statins play a big role. I think that keeping your LDL.
What levels should people look out for starting statins? Because we all know there's a lot of controversy that happens, and at times, muscle aches and side effects also happens at times for participants. We've also seen with overdose of statins in American population, whom we handle from India, because people from across 90 countries join our programs. We've seen at times them undergoing some degree of memory loss, or sometimes TSH levels elevated, sometimes hormone production getting affected. So yes, we need them also, but we need them in the right dose. We don't need to overdose them, is an understanding that we've come to. So what kind of levels people should watch out for, let's say, LDL, or let's say ratios between total and HDL, where they should start them or maybe increase them, would be your suggestion?
Well, I mean, I think it all depends on your risk profile. So if you have a very strong risk profile, then I think the lower the LDL, the more likely there'll be some benefit. So the threshold would decrease the higher the risk profile. So as cardiologists, we typically say that if you've already had a coronary event, that you should aim for an LDL less than 70. There's some data to suggest that LDL can be pushed down, even down to 40, and that the risk continues to decrease from 70 to 40. But I think it's pretty well established at this point that you really want your LDL, especially if you have coronary disease. Now, if you don't have coronary disease, the data on using statins for primary prevention, for prevention in someone who's never had heart disease, is weaker. And so I would say that for those patients, you can have a threshold to start a statin that's significantly higher. And it depends on your age, and it depends on what your 10-year risk is for heart disease. But let's say, if you're a middle-aged person who, has a less than 5% chance of developing heart disease in the next 10 years, according to the basic, heart disease risk calculator, then I would say, starting a statin with an LDL of 160 is certainly reasonable, 160 or higher. So it all depends on the risk profile. And this is an area that's still being developed.
You get a range 70 with already an event, 70 and below, and up to 160, one can wait and watch if one doesn't have the event broadly. Of course, all these decisions are not to be taken by the patients. They have to be taken in consultation with the cardiologist.
With your doctor.
Many times in India, we have reports and people don't take them seriously, or they are seen by doctors at times who are not, at times a little bit more pessimistic, might start too early, or too optimistic and may not start when it's needed. So these are numbers which you just need to keep in mind and have an informed decision after consulting your cardiologist. So coming back to the main thing in terms of your experience of reversal on coronary artery disease and your recommendations for that, it'll be interesting for all of us to know that.
Yeah. Well, I mean, look, if you have coronary disease, I would say that you want to mitigate the factors that we know increase the risk of further development. So you want to take a statin. I think that's very reasonable, especially if your cholesterol is elevated. You want to control your blood pressure. You want to eat well. But I think that you also want to reduce your emotional stress. I think that is a key factor that we tend to ignore, and that cardiologists generally tend to ignore, because, it's easier to focus on cholesterol because we can reduce cholesterol. We can reduce blood pressure. It's much harder to reduce emotional stress. And so doctors tend to shy away from it.
And we are not trained in it.
We're not trained in it. We don't know what to tell patients. You have a difficult relationship with your wife or your son. How do we tell them to navigate it? So it's so that's really more on the patient. But I do think it's important to recognize that emotional stress is a key risk factor, and it needs to be modified.
Wonderful. I think that emphasis should go a long way for all those who are watching the program right now or later. And I think we all would, over a period of time, start taking it seriously. If we don't, we're going to get feedback from the body in terms of numbers on the reports, or a little jhatka, little stress coming directly from the system. Great. Towards closing this particular video, would love to know, again, what can be reversed, what cannot be reversed regarding, heart blockages, and any closing remarks of yours.
Yeah, I mean, heart blockages can be reversed because we know that the blockages are filled up with immune cells that gobble up cholesterol. And so, reducing cholesterol, reducing stress that can activate the immune system can all be beneficial in decreasing coronary plaque and reversing coronary disease. What can't be reversed is once you have a heart attack and the cells in the heart muscle die or get replaced by fibrotic tissue or scar. Once that happens, there's very little evidence that there's significant heart cell proliferation after a heart attack. So I'd say the most important thing is prevention, because at the prevention side, you can still reverse things. But once a heart attack happens and scar develops in the heart, it's very hard to reverse that. So I think prevention is the key, and unfortunately,
And calcified
cardio-
blockages, any view on calcified blockages?
calcified blockages, may be more stable actually than non-calcified blockages. So that's one of the reasons why I think older people can have very significant coronary disease, but they kind of chug along for a long time, whereas younger people can, drop dead from a heart attack suddenly without showing a lot of coronary blockage, because they tend to have non-calcified plaques that are vulnerable to disruption and the formation of clots. So I would say that the more calcified the plaque, ironically, probably in many cases, the more stable the plaque. But that's an area that's actively being investigated, because we want to know what's vulnerable to rupture and what's not vulnerable. And we don't have a great idea at this point. So I would say that if you know that you have plaque and it's calcified, it's just important to talk to your doctor about what your risks are.
Sure. Great. So everyone's invited to explore Dr. Jauhar's book on heart insights.
Heart a history.
Heart history. And
Heart a history, yes.
Heart a history. And sure. So any final words of wisdom from your rich experience before we close?
No, I mean, I think that, if anything, what your organization does in focusing on prevention, that's super important. We want to, turn off the faucet, not just mop up the floor after the water is flowed, So I think prevention is really the key and is the next frontier for reducing heart disease death, across the world. Heart disease is still the #1 killer worldwide.
Oh, yes. Great. Thank you so much for joining us from New York City. And we wish you great energy for many, many more books to come and many, many more words of wisdom reaching many, many more people across the planet. Thank you so much for being with us.
Thank you.